it's going to be a wait and see how vigilant was the population over Thanksgiving to stop and slow the spread of the virus.
After weeks of warnings and begging people to stay home, healthcare workers are waiting to see whether Utahns actually listened over the Thanksgiving holiday.
In Fox 13 News team coverage, Max Roth has an in-depth look at the loss of life in Utah due to the virus.
But we begin with Sydney Glenn at the University of Utah, who spoke with medical experts about concerns after the holidays. Sydney.
Bob and Amy, an infectious disease physician we spoke with today, said he's really concerned about the next couple of weeks. Now, it's going to be about 10 to 14 days before we start to see those COVID-19 cases from the Thanksgiving holiday, and even a couple days after that before we see how many people get sick enough to end up in the hospital. When Erin Klaus started working from home, she let her extra time and curiosity teach her something about COVID-19 trends.
I wanted to see for myself. I thought that there was maybe some interesting stories in the data that maybe weren't being described very well.
She started making graphs like this one showing who was getting sick and the increases and decreases in each age group.
It's just really interesting to see human behavior really leading to spreading of this disease over and over again.
Now, the University of Utah Health, whom she works for, is also utilizing the graphs to see trends and educate people, like to show how deadly the disease is. Let's look at the Thanksgiving holiday. While we don't know the impact yet, Klaus says after every holiday since the pandemic, we've seen a spike in cases.
Unless people really took the public health warnings and stayed home and didn't congregate as multiple household units coming together, this has the potential of being a big spreading event this entire holiday season.
Some good news, hospitalizations and the rolling 7-day positivity rate seem to be going down here in Utah. But Dr. TODD VENTO with Intermountain Healthcare worries what this holiday weekend could do to that trend.
The next step would be, are we going to have what's being called a surge within a surge because of something like a super spreader event like traveling associated with Thanksgiving? If that were to happen, that's when I think you would see what people are considering to be a tipping point of having to transition into more of sort of crisis standards of care potentially.
Thanksgiving is the first of many holidays and events to come. And remember, we are still seeing a surge in cases. Klaus says right now in Utah, 1 in 50 people actively have the virus.
If you go into Costco, if you go into your grocery stores and you look around, there's more than 50 people. Right? The likelihood of at least one person having the virus is pretty high.
As many of us continue to work from home, health leaders ask you to also stay home and help prevent a surge within a surge of COVID-19 cases, even if that means changing up some of your holiday traditions. A spokesperson for the Utah Department of Health said right now is really all about mitigation. So if you do plan to, let's say, gather with people outside of your household, or you decide to travel, make sure that you are wearing a mask, you are sanitizing, you are keeping that distance. If you feel like you may have been exposed, that you are quarantining and taking all of those extra steps to try to help not just yourself, but also the people around you. Live at the University of Utah Health, Sydney Glenn, Fox 13 News.